Hey guys, Dr. Josh here, and today I wanted to share a quick win of the week. And this win of the week is really just a testimonial that I'm giving on behalf of my patient. So long story short is we had a patient that was referred to us that came in, and she is 10 years old and she injured herself, right? She's a very competitive figure skater, but anyway, the point is that a 10-year-old should not be in pain. They should not be in discomfort, and neither should you, right? So we all know that pain or discomfort or tightness is just a symptom of something else happening. So if you're just trying to figure it out, well, just know that right away, the step one is identifying the problem. And if you're discussing pain or discomfort, that's an issue. So anyway, this patient recognized that there's pain and discomfort and there's some problem going on, and they decided to seek me out from care. So the backstory is that this patient injured themselves and they were undergoing 16 visits of physical therapy. They've already had this pain for 2 months. They've had 16 visits of physical therapy, and they were driving 1 hour each direction, doing an hour of physical therapy in order to solve this problem. Again, an hour each way, that's costing them a ton of time and energy, a ton of effort, and I'm sure a decent amount of money going there and back, as well as the 16 sessions that they already saw this physical therapist for. So once they see this physical therapist, she goes from a 7 out of 10 pain to a 4, possibly a 3. Now, so while that's over the course of 2 months. So over the course of 2 months, they're only improved about 30%. When I saw the patient yesterday, they said that they could only do 50% of their activities. So imagine if you're out there, your day-to-day lifestyle is doing whatever it is. And in between that day-to-day lifestyle, you're only able to complete 50% of it. So if you want to lift 100 pounds, you can only lift 50 pounds. If you want to run a 10-minute mile, you can only run pretty much half of that, right? You can only, double that really. So a 20-minute mile. If you could only work 4 hours a day out of the 8 hours a day, that would be equivalent to her job, right? Her job is school and skating, and she could only do 50% of her skating because of the discomfort. Again, 1 hour direction each way, 1 hour of physical therapy, and 1 hour on the way back, and 16 sessions later, she is at a 4 out of 10 and getting a little bit worse, so they decided to seek me out. So after seeing this patient, I was able to figure out exactly what the cause was and not the symptom, figure out how to help this person, and in one session, I was able to ask the patient, do you feel better, the same, or worse? Sometimes you don't see any results in the first visit, but she already reported by the time she was leaving that she felt a little bit better. Fast forward 4 to 5 hours later, I called the father up on the phone and said, how is she doing? How is things going? And she said she feels better than she has ever felt in the last 2 months after one single session. So that just goes to show you the power of what we do in our office, the power of a sports medicine specialist, the power of a soft tissue specialist, and the power of actually figuring out the problem and not just treating the symptom. Because that's what I think was happening, is that the problem was getting compounded with the symptom, and the patient wasn't getting their true results and getting over their true pain. Again, we all know that pain and discomfort is not ideal. We know that we don't want it, but if you don't do anything about it and you don't go see the right provider, then you're not going to ever get over that hurdle. So again, the reason I'm telling you this is because if you or somebody you know is suffering from discomfort and pain, it doesn't take a lot to get out of it. There's only one difference between that result that patient came in with and the result that you're having right now, and it's action. Are you taking action on your pain? Are you taking ownership of it? Are you really seeking out the right provider, or are you just looking, what is it going to cost you? Is it going to cost you a ton of your time like it did these people? Did it cost you a lot of money because you're not doing anything? Are you losing money on your job because you can't properly perform well? Are you losing out on your social and mental and physical well-being because you're not able to actually take action on your pain. So again, this patient did so well, and so well that they're actually coming back in this week, and they will continue to get better because we are addressing the true cause. All right, so this could be you, this could be somebody else that you know, but at the end of the day, what we do in our office is treat the actual problem, not just the symptom, in order to get you to the results that you want and you desire. So all you have to do is make a decision and choose now and take action on that decision. All right, so hopefully this helps you. Hopefully this gives you a little bit of insight on what we do in our office and how we really help people. All right, thanks again for stopping by. We'll see you guys next time.